So in this tutorial I am going to complete the discussion, the heart cycle 4. In this cycle the ventricles relax. You can see the outward arrow I have shown with ventricle 3 and 4. Okay. And diastole commences. Diastole means relaxation of ventricles. Blood enters into the right and left atria once again, because now ventricular pressure is reducing, so blood will start entering. Because ventricular pressure is reduced, so blood will start again flowing from the veins and pulmonary veins, from inferior and superior vena cava and from pulmonary veins into the atriums. So blood enters into the right and left atrium once again, and the cycle will begin. Ventricular and aortic valve remains shut. Now 7 and 8 will remain shut now. Okay, and this prevents backflow into the ventricles. If the 7 and 8 will remain shut, so blood will not flow from pulmonary artery or aorta into the ventricles. So now let us talk about. So these are the 4 heart cycles. Now let us talk about few terms which I don't think I have discussed, or maybe I spoke about them, but in a very brief manner. So let us talk about what is semi-lunar valves. This aortic and pulmonary valves are also called semi-lunar valves. So aortic valve and pulmonary valve has another name called semi-lunar valve. But if you want to specify, then you have to mention whether it is an aortic valve or is it a pulmonary valve. So aortic and pulmonary valves together can be called semi-lunar valves. And now what is pulmonary valve? Now pulmonary valve exists at the junction of pulmonary artery and right ventricle. So it exists at the junction of right ventricle and pulmonary artery. If you can open the diagram, you can see that pulmonary valve is at the junction of right ventricle and pulmonary artery. Then what is aortic valve? Now aortic valve is at the junction of aorta. Aortic valve, it is situated at the junction of, or located at the junction of left ventricle and aorta. Left ventricle and aorta. So aortic valve prevents backflow of blood from aorta into left ventricle, and pulmonary valve prevents backflow of blood from pulmonary artery into right ventricle. Let us talk about few more terms. Atrioventricular valves. Now remember this tricuspid and mitral valve we talked about. They together can be called, these two valves can be called as atrioventricular valve, because they are at the junction of atrium and ventricles. So they prevent backflow of blood from ventricles to atrium. Through these valves blood flow from atrium to ventricles, and these valves prevent backflow of blood from ventricles to atrium. So tricuspid and mitral valves are called atrioventricular valves. Okay. Let me show with the existing diagram how this backflow of blood is prevented using these valves. So valves actually prevent backflow of blood. Any valve, even in a bicycle pump, all these valves prevent flow of fluid in one, facilitate flow of fluid in one direction only. So valves will, because of these valves, any backward flow will be prevented. Now let me show with a diagram, one of the existing diagram. Now watch very carefully. You see this tricuspid valve 5. See this arrow I showed, and then I cross that arrow. That means this direction is prevented. That means from ventricle to atrium is prevented. Similarly, mitral valve from ventricle to atrium is prevented. So I drew an arrow, black arrow, and crossed it. Similarly, this pulmonary valve, this flow of blood from pulmonary artery to ventricle is prevented. I showed an arrow.